Thank you for watching. This is the Doctor for Pets show. I do believe it's the #1 rated veterinarian show that I know of.
Should be.
I'm Dr. David Randall, veterinarian here in Collier County for, my gosh, since way back in the 80s, second generation. Mr. Glass sitting next to me is the international dog trainer, him and his wife, for the last 2 years in a row. Mr. Glass is with Barkbusters. How's it going, man?
Great, thank you. Yes.
So, a wise man said, who needs Dancing with the Stars when you have this show, when you have Mr. Glass and Dr. Randall together, right?
That's exactly
I can't remember who that wise man was. But
neither can I.
He was very wise. All right, guys. We've been doing this for a long time, and a lot of you know how this works. Very simple. 3 phone lines, 5-second delay. Turn your volume down if you're going to make a call. 1 phone number, 239-417-4711, okay? And any question you have, especially towards dog training. I mean, that's why this guy's here, okay? I mean, the veterinary stuff, we can always do that. We can do it every single week.
You do it very well, I have to say. I watch your other shows, and they're very good.
I try.
Yeah,
I try very, very hard. I can give you an update. You guys know that I've been telling you that Maya, my 4-year-old English lab, was pregnated, and it felt like she had 3 puppies inside of her. Then Jamie came over and we did x-rays, and Jamie's got that on film. She had 2 kind of normal-sized puppies, and one was a little bit smaller. So I was still hoping for more than 3, but lo and behold, Saturday I'm at work, and Christina picks up the phone and says, she's delivering.
My goodness.
In my closet, in the bedroom.
Well, is that not fairly typical?
It's wherever it's where they're comfortable. It's where they feel safe and protected.
Yes.
And you want some place that they're going to feel safe and protected. You don't have to build something for them. They'll find the area that they like.
Yes.
And I like my closet. And she likes my closet.
Obviously.
I'll tell you what. Monday, thank goodness, I can't even tell you how many sheets that we've washed, but Monday we got a hold of Mike over there at the kennel, and I said, Mike, when you're done doing your routine daily chores, please go give her a bath. She really smells. So I gave her 1 bath. She walked around and then rolled in the sand. So I gave her a 2nd bath.
Yeah.
But anyway, such is the life of being a veterinarian, dog owner, everything else.
Exactly.
But it's very exciting, and I've got all of this on film. I'm going to have a little snippet for you in a couple of minutes, just so you can see a little bit of the delivery, but we'll have a whole show as far as the pregnancy. Hi, Chris. I'm Dr. Randall. We've got Mr. Glass here. What can we do for you tonight?
Well, Dr. Randall, I am calling about a 13-year-old Cocker Spaniel. Over the last probably year or so, he's lost a lot of his hearing, and now he'll be in the house or in the backyard, and he'll start barking for no apparent reason.
Right.
I mean, no people, no noise, anything like that. And he won't stop for a couple minutes.
Right.
So my question is this medical? Is this psychological? Is he neurotic? What precipitates this?
We'll have two. I tell you what, Chris, we got 2 different opinions here, okay? I'm going to tell you the medical part. A 13-year-old Cocker, I guarantee you this dog has cataracts, and his vision's going to be poor. And we know how chronic some of these ear infections are in the Cocker Spaniel. So they are the first dogs that normally go deaf. So I think you're dealing with a combination of confusion. And dogs, besides having confusion and he's lost in the backyard, they also have signs of Alzheimer's, all right? Have you taken him to a vet and had them at least check for an infection in the ears?
His ears are perfect,
okay,
and his eyes are perfect. There's no cataracts at all.
You have to be kidding me. This has to be the world's first time ever.
Well, we take really good care of him.
Wow. Wow.
Yep.
A 13-year-old. I'm telling you what. If you come down to Naples, I'll give you a free exam just so I can see a 13-year-old Cocker that doesn't have cataracts. But all right, so if he goes in the backyard, and I will too, Chris, by the way. Okay, just remind me if you come in, make an appointment for Dr. Randall, and because I would love to see it. It's absolutely amazing. But if he's in the backyard and he's barking, I would then assume that I'm dealing with possibly Alzheimer's and confusion, and there is medication for that, a very simple medication, Anapril. They take a capsule every morning, and it turns the clock back. Now,
How do you spell that?
Anapril, Anipryl. Let's see.
Okay.
Anipryl. What's he weigh?
33.
33 pounds. So he's 15. He's 15 kilograms. He's going to take Anapril, 15 milligrams, one capsule every morning, and do that with just a little bit of a treat, and then feed him about a half hour later. And I bet you within 30 days you'll see an improvement if it is Alzheimer's. Okay.
Okay, I thought maybe he was just doing this because he hadn't heard himself bark and he was looking for the sound of his voice.
Yes, that is possible. And I cannot test him to see if he's deaf, because even if we do test in the exam room, if we drop something on the floor, the vibration of the floor or the wind coming by will do it. But what do you think, Colin?
I think the dog's frustrated because he's deaf. He remembers what it was like to hear, and now he can't. So this is kind of salving his need for communication. Now, you can absolutely train him to stop the barking on command. That can be done. But whether at 13 years old you want to bother doing that is another matter. If he is deaf, it's like we put up with a lot of things from our seniors that we might not put up with from people who were half their age. So it's really up to yourself whether you want to invest in training to have them stop doing that. It's that's your call.
Well,
it can be stopped.
Well, the interesting thing also is that he does hear some things, because if there's a loud sneeze, he can hear that. He reacts. So he's not totally deaf. So that's good.
Well, hopefully the Anapril will make a difference and stuff. But I will tell you this, and I've had a lot of older pets, like much older than 13, and what's most bothering to me as a pet owner is when they start kind of crying in pain, or they it's 4 o'clock in the morning, and of course you wake up when puppies cry, you wake up when kids cry, and when the old dogs cry, you wake up. Okay, so you're exhausted.
Thank goodness he doesn't do that.
Well, good, because I'm telling you, I got the treatment for that one too. Okay.
Yeah.
You give them Valium about a half hour before they go to bed. You got 8 hours of sleepy time.
And by the way, when he's sleeping, sometimes he'll come up with a bark.
Well, he's dreaming.
It's almost like Tourette's.
Yeah, now he's
dreaming.
He's dreaming.
He's dreaming.
Okay.
The other thing is your comment about the sneeze. A sneeze also produces a shock wave, and that's probably why he's getting that, as opposed to just the sound.
Right. He could do it. All right, Chris. Hey, I can't wait to see a 13-year-old cocker with no cataracts. Okay.
Okay. We'll see you later.
All right. Thank you for the call. Bye-bye.
Good call.
Oh, excellent call. Yeah. Excellent call. Mary, I'm Dr. Randall. Plus, we have Mr. Glass here from Barkbusters. What can we do for you tonight? Mary, you there?
Yes.
Hi. What can we do for you, hon?
Oh, hi. Yes, I have a dog that I rescued, and he's about a year and 5 months old.
Okay.
He's as sweet as could be. The only problem I have with him is when I go out, taking a walk with him, he meets another dog, he might sniff it, if it's a little dog, but then he'll growl and he'll bark and bark and bark. And I've taken a can, put stones in it and shaken it, but that doesn't do any good. He gets all uptight. How
Boy,
can I
sure sounds
stop
like
him
he's very
from doing
protective
that?
of her or something.
Yep, it does.
You said so. He's a young dog, less than a year and a half, right?
Yeah.
What does he weigh?
He weighs 9 pounds, and he's part terrier. They said silky terrier, but he has a terrier face, but he doesn't have the ears or, he's dark gray, and he has light gray going through him.
Nice.
And he's so sweet at home, and but
Where did you adopt him from?
the rescue place up in Fort Myers.
Yeah, nice. Nice. Mr. Glass, it's all you.
Oh yeah, I've got some questions for you, because this is very, very interesting. Right. First of all, how long have you had the dog?
I've had him since February.
Okay. Secondly, are you using a retractable leash when you walk him?
Yes.
Haha, there's your problem. Now, the thing is, what you must understand is that dogs.
Mary, you know he was going to rope you in on this one, okay?
Oh yeah.
He's going to rope you in, and he's going to rope the dog in. What's the dog's name, by the way?
Benji.
Benji. All right.
Right. Listen. This is the you equivalent of you with your digestive issues with dogs. Right. Now, the thing here is that I want you to understand this. Benji, like other dogs, does understand the concept of gratitude. Benji, I'll tell you, I've not met him, I've not met you, but I'll tell you this, he adores you and he is very grateful to you for rescuing him. He knows he's been rescued. Therefore, when you're out for a walk with him, he feels that it's part of his job description to defend you against any possible danger, even when no other danger is apparent. Now, the fact that you then have him on a retractable leash, which when you see the other dog, you click and it goes tight, it sends this message down the wire here to the other dog, look, summing up here, you need to be aware of this. And he looks down and he says, what is it, what is it? Oh, it's another dog. Bow, 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 bow. You've got to stop that, because otherwise he will challenge other dogs, and he doesn't care if they're big or small or good or bad or have got up to date with their shots or not. He will challenge other dogs. What you need to do is you need to have him on a normal 6-foot leash with a collar. This collar is far too big for him, but a collar that works in the same method as this. And what you do is you give him a light check and release. So it's just a noise like that. You're not choking the dog, but you're giving him a sound and in his which comes out behind his ear that lets him know that, hey, you've got everything under control, everything's fine, and the leash goes loose again, and the other dog is no big deal.
Mary, let me tell you something just as a pet owner, okay? When you have a 4 or 6 foot leash, and you need to work this in your house or in your lanai or in your driveway, that dog needs to be on your left side, okay? The dog is on your left side, sitting there, walking as you walk, side by side, step for step, okay? And to where you can put him in check, to where you can sit there and do that. And
Yeah.
it's not a constant pull. And here's the retractable leashes. The dog is everywhere. The dog's here, it's over there, then it's behind you, then you fall down, you break your knee, you break your shoulder. It happens. I see it all the time, okay?
So a 6-foot leash?
Yeah, just a 6-foot cotton leash. You can get one for him that would cost you about $8 or $9 or something like that.
And this type of a collar, this is not going to hurt him,
No.
okay?
Oh, okay.
You would get it's a.
I
smaller-
use what I have on him now is a harness.
Yeah, I can.
You
under, I
can't
can
control. You can't control him. It's
Yeah.
not the same thing. This, okay. What we say lovingly is that June and Colin Glass speak dog. Okay, and this is the translator to dog. This noise. Okay, this is the noise specifically that dogs understand. I'm
Correct.
sorry, I'm stepping.
No,
stepping on your stuff.
you're
I
right.
mean, I just.
You're right.
Do you call that a choker collar?
No, it's not a choke collar. It's a check collar. It's important. We're very, very strongly opposed to choke collars.
If you write me a very large check, I will give it to you. It's a check collar.
Oh, okay.
No, but listen. The other very, very important thing here is, and this is for your safety. If you do this, if you're out with the dog and you're on the retractable leash and another dog really challenges you, I've seen dog owners pick their dog up, and they pick it up here for safety reasons. And you know what that does to the other dog? It gives a message, oh, this dog here, because he's higher up, is dominant to your dog, and that makes him, the other dog, even more annoyed, and then he'll attack the owner. So don't pick him up or bend you up. You
No, I
can't do
wouldn't
that.
pick him up.
But honestly, you need to bin that retractable leash.
Okay, well, I'll get the 6-foot leash and I'll get that kind of a collar.
All right, where do you live?
I live in Estero.
Okay, if you have to, if this doesn't work for you, I guarantee you will. If you put that dog on your left side and you spend 10 minutes 3 times a day, within 1 week, it's going to be cured. If that doesn't work, you contact Barkbusters, okay? And I guarantee you, Patrick will get it fixed up for you,
Yep,
okay?
absolutely.
One visit, Patrick will have it done for you, okay, hon?
Okay.
All right,
Thank you, sir.
hey, thanks for your call. Guys, we're going to take a short break. Stay tuned. I'm Dr. David Randall from Big Cypress Animal Clinic and your doctor for pets. I want to introduce you to the iTherm, a non-invasive, fast, effective healing, rehab, and pain management system. This is Kevin.
iTherm is molecular hyperthermia. It can treat a variety of disorders ranging from cancer, arthritis, hip dysplasia, soft tissue management, wound healing. Very simple, non-invasive.
And it works.
It works.
It
Highly
works.
efficacious.
It works. Now exclusively at Big Cypress Animal Clinic. Good combination right there. Good questions.
Yes,
we
they
got
are.
2 more callers.
Yep.
Let's fire away. Frank, I'm Dr. Randall, and we have the world famous Mr. Glass here. What can we do for you?
Well, I think I have a training question for you.
All right.
Okay, we have a 10-month-old teddy bear, a mixture of a Shih Tzu and a Bichon.
I love the teddy bears. I love them.
Yeah, they're nice. And we've done pretty good as far as housebreaking. We've done pretty good as far as walking on a leash. She's gone to puppy school through one of the pet store chains, but we've seemed to have hit a roadblock where she will understand no on certain things, but like right now she's still wanting to jump up and kind of nip at the fingers. When you don't pay attention to her, she can get really what I call like a wild woman. It's female.
I've never seen a wild
barking
woman.
like crazy.
Hey, Frank, I've never seen a wild woman before.
They're all wild, believe me. Listen, look, Frank, I'll tell you, part of this problem here is this dog is just too damn cute. And because they're so lovely to look at, I mean, teddy bears are just great. Because you're so lovely to look at, that it's kind of difficult to discipline them. Now, when I say discipline, do not think I infer any form of pain, because I absolutely don't. All I mean is giving her a clear message as to what is acceptable and what is not, and that you do that by communicating with them, not by hurting them. Now, jumping is actually, of all the dog behaviours, jumping is the easiest one to fix. That, I mean, trust me, it absolutely is. And it's not done the way the canine dogs do it either. But it's the easiest one to fix. The nipping, etc., what she's trying to do is she's trying to dominate you in a very nice way, in a very passive way. She is trying to control you and tell you when it's time to play and time to do other things. So, with the exception of her demanding toilet breaks, which is in everyone's interest that she gets, you have got to make the decisions about when everything happens. In other words, when is playtime, when is feeding time, what games you play with her, etc. And you should initiate them with her. And if she demands that you play with her, just do not do that. Do not give in to that. And when I say ignore the dog, I mean and this is very, very important. This is ignoring with dogs is very different from ignoring with humans. Zero eye contact with her. Don't think you can look at her and not give her attention, because if you do that, she knows you still love her and everything else doesn't matter. Does that make any sense to you?
Yes, it certainly does. And the kind of issue is she will behave more like that with my wife than with me.
That's not surprising at all. Number one, you've got a deeper voice than your wife. Number two,
We hope.
we hope. Number two, you're probably a bit taller than her, and dogs equate height with dominance. And your wife, she probably sees her, the dog probably sees herself on a par with her. Don't let the dog, by the way, if this is your wife, don't let her sit up here on the sofa with her, because she's level with her. If she wants to sit up on the sofa with her, that's fine, but she should sit at knee level with her.
I think something else, Frank, is that if you do correct her, if there's something going on, and if you do the bob word or whatever, don't call her name. The bottom line is, do not call this dog's name. Do not let it on the top of the couch higher than your shoulders and stuff. It can stay down at leg level, and I think he needs to have more of a time set. I mean, almost make a schedule.
Yes.
You know, like every 45, every hour, he's going to do something with the dog. Even if it's 5 minutes, he comes back in, and that's it, and then no more eye contact. And she'll start to get the routine as far as what they're doing.
Yes, and everything's initiated by you guys, not on her demand. And please tell me, I know I've said this earlier in the program. Please tell me she's not on a retractable leash.
We actually use both.
Well,
I prefer the
using them.
retractable because she behaves, I think, pretty decent.
No, but
She's
but
in charge.
For the most part, we use.
Frank, the problem, what Mr. Glass is trying to tell you is that when she's on that retractable leash, she's in charge of you because she's over here, she's over there, she's over there. She's not.
Okay.
She's not next to your left leg, going out for a walk and doing things, or walking over into the grass and everything. Okay.
And-
retractable leashes. I understand the purposes of those, okay, but they're not very good, especially for any training, okay?
And the thing is this: if she's leading you outside, why wouldn't she lead you inside? It's perfectly logical. And dogs are extremely they're among the most logical animals I've ever come across.
I'm pretty logical.
Yeah?
Now,
You're
not as much as a dog.
What do you offer in the way of training should we not be able to get her out of some of these bad habits?
Where do you live, Frank?
Cape Coral.
Okay, well, you need to, if you phone the Barkbusters number, my colleague Patrick, he lives in Fort Myers and he looks after Cape Coral. He'd be very happy to do that for you. And have a look at his website. He's got some tremendous YouTube videos on there of dogs that he's trained. He's a first class master trainer with Barkbusters, and you'd be in very good hands there. I'm just sorry you don't live in Naples or Marco Island, because I would love to work with you and the teddy bear.
Hi,
Well,
Frank.
if it gets to that point, I'd be willing to travel that far.
Well,
I have to live down here.
yeah, he has to live.
All right, Frank, thank you for the call, okay, guy?
All right,
Keep
thank
in
you.
contact.
Thank you.
Linda, hold on. We're going to take a short break here in just a second. Guys, remember Pet Pages, okay? This is a free at your groomers, at your vet's office, and it's almost like a dog phone book, okay? It's perfect. One other thing, any dog can bite, okay? Now, that is about as most common thing as I've ever heard.
Yeah.
But somebody decided that National Dog Bite Prevention Week is May 18th through the 24th. Just remember, guess what? Any dog can bite, okay? Whatever that's worth. Jamie?
850,000 of them did last year
850,000?
in the US that were recorded.
Wow, I got to make a note of that so if I mention that again. Or that may be on a quiz for me someday.
Yeah.
All right, Jamie, let's take a break. Be right back. Dr. David Randall here. Welcome to Big Cypress Animal Clinic. Big Cypress Animal Clinic is on East US 41, Naples, Florida. It's a member of the American Animal Hospital Association. Big Cypress Animal Clinic is a full-service hospital. Puppies, kittens, and all your adult pets' needs. Boarding, bathing, x-rays, surgery, blood work, right on the premises. Come in and meet our professional staff. We have Dr. Carrie Fortu, Brother Barry back here, and all the other professional people that work here at Big Cypress Animal Clinic. Come in, I can't wait to see you soon. Good day. I'm Dr. David Randall for Big Cypress Animal Clinic and your doctor for pets. I want to introduce you to the iTherm, a non-invasive, fast, effective healing, rehab, and pain management system. This is Kevin.
iTherm is molecular hyperthermia. It can treat a variety of disorders ranging from cancer, arthritis, hip dysplasia, soft tissue management, wound healing. Very simple, non-invasive.
And it works.
It works.
It
Highly
works.
efficacious.
It works. Now exclusively at Big Cypress Animal Clinic.
G'day. Does your dog have a nickname? If your dog's behavior keeps you inventing new nicknames, remember this name. Barkbusters, the world's most trusted dog trainers. They'll transform your dog into a happy, obedient companion in just 2 hours in your home and provide a lifetime guarantee. Rate your dog's behavior at barkbusters.com. Barkbusters, training dogs the Aussie way.
I'm Dr. David Randall, a second-generation veterinarian at Big Cypress Animal Clinic in Naples, Florida. I recommend FlexPet because it's the most complete natural formula available for joint health. Pets love the taste of it, and FlexPet works. It's great stuff. Come into Big Cypress Animal Clinic in Naples, Florida, and pick up a bottle of FlexPet.
Call today for a special introductory offer. That's 1-888-END-PAIN. That's 1-888-END-PAIN.
You guys are going to love this, okay? I got a small snippet of what was happening in my bedroom closet over the weekend. Jamie, kick it up there, man. That is a towel and a lab puppy and the second lab that was just born.
Good girl, Maya.
Just
Good
getting
girl. There's two
nursed for the
puppies.
first time. I've got a lot better videos than that, okay? I've got the whole birth process going on. So I can't wait to get that put together as a show. Mr. Glass, we have two other callers. We have Linda and Marianne. Let's get to them. Linda, are you available?
Yes, I am, sir.
What can we do for you?
Okay, hi. My little dog, Marty, we've owned him for about a year. He's got very, very bad allergies.
Mm-hmm.
You had recommended Atopica, so I went to my veterinarian, and we had him on Atopica. And then they came out with the Apoquil,
Yes, ma'am?
and my veterinarian doesn't get the Apoquil every month.
Right.
Sometimes I have to switch back to the Atopica.
Right.
Now, I'm worried because it takes 2 weeks for the Atopica to get into his system. So switching him back and forth.
Linda, I'm sorry. What I can tell you about Marty, why don't you just plan on keeping him on Atopica, okay? I like Atopica. We've used it for 5 years. It's a good product. It's very affordable. And
Yes.
The problem with it is that Apoquil, I am allotted 200 pills every 2 months, okay? I mean, that's nothing. That's nothing. I went through my first allotment in less than a month. And
Yeah.
but anyway, just put them on Atopica, and like I said, watch for those staph infections. Make sure that you're giving the fish oil, the omega fatty acid fish oil, and that's the best you can do right now at this point, okay?
But he still has bad allergies. He drags his little butt around the ground, and his anal glands are clean. I don't know what else to do for him. And it's breaking my heart because he's allergic to everything.
Linda, let me tell you one other thing you can do, okay? Get a blood test, find out what he's allergic to, and instead of giving allergy shots on top of everything else you're doing, put drops on his tongue. It works, okay?
What'd you say? Put drops on his
It's
tongue?
an allergy. You got to do a blood test, find out what he's allergic to. They'll make up a vaccine, and instead of giving him a shot, you put it on the tongue, okay? Hey, we got to go. Marianne, stay on. I'll pick you up after this. Mr. Glass, thank you, sir.
It's a pleasure.
We'll see you guys next week. Bye-bye.